Minimally invasive spinal surgery is performed through the use of microscopes, tubes, or a special retractors that allow for the access to the spine without compromising the surgical objectives and minimize the risk of soft tissue stripping, allowing for quicker recovery. Intraoperative navigation is a technique used to guide the surgical intervention through the utilization of advanced imaging. So in simpler terms, the patients are scanned either during the surgery or before the surgery, and then special tools are then applied to allow the surgeon to visualize the various anatomic component of the patient's spine during the surgery, which then makes the surgical intervention very accurate and reduces the risk of complications significantly. Sometimes we can combine the two techniques, the minimal access to the spine and the accurate guidance of intraoperative navigation, to allow for an even more focused approach to dealing with the spinal pathology or problem. This further enhances the recovery and improves the outcome more, while reducing further the complications associated with more complex spinal interventions, such as putting screws or putting fusion cages in the spine. Intraoperative navigation is an imaging technique. It is not associated with a risk directly. In certain situations, and because we do require additional imaging that exposes the patients to a slightly higher radiation exposure, but that is only a temporary hazard that has not been shown to be associated with any untoward events following surgery. The technique, however, the spinal navigation technique, is very much user dependent, and the person using it has to be familiar with the technique to guarantee getting the best outcomes from it. Otherwise, problems will be faced. Minimally invasive spinal surgery has been fundamentally designed to improve post-operative recovery. And for that reason, it is expected that, based on the magnitude of the surgical intervention, that the patients will or can go home either on the same day of the surgery or the day following the surgery with minimal pain, minimal requirement of pain medication, and with good restoration of function.